I let my guard down. It simply means up to the point that I got tested, I was negative. But it's also important that the day after and the day after that and the week after that, that I continue to put on this mask. And you've seen me at a number of events, and sometimes I have on one, and sometimes I have on two. So I'm asking you to do the same. If you do test positive, please answer the call, email, or text message from our contact tracers so we can break the chain of this transmission. We are better together. Let's work together to stop the spread. We slowed this virus before, and I do know that we can help to prevent another surge of this virus coming into the city of Houston. At this time, let me stop and introduce the Chief Medical Officer for the city of Houston, Dr. Pearce.
Thank you, Mayor. And as the Mayor pointed out, the positivity rate and the number of cases that are reporting daily is going up. On the screen now, you'll see the wastewater map that we've shown before. And quickly, those areas that are in green shows that there's a decrease in the amount of viruses found in the wastewater. Those areas that are gray, it's basically stable. And those areas that are red, it's increasing. The advantage of the wastewater over positivity rate is it is inclusive to every neighborhood in the city. And it also verifies that what we're seeing with positivity rate, it validates that finding that the amount of virus that's spreading through the community is going up. And so we now have three metrics, and we have historically we've been saying don't pay any attention to one particular metric, nor do you have to pay close attention to any or hang your hat on any one particular value. But we now have three metrics that are showing increased activity of virus in our community. So that's the bad news. The good news, if we go to the next slide, is that the hospitalization rates are remaining relatively stable. Now, if you look carefully, you'll see that, and in the top, what we have here is the patients who are admitted to the intensive care unit. The red line is those are confirmed COVID cases. The blue line are the ones that are waiting for the test to come back. In the lower graph, it's the non-ICU beds. Again, the red line is confirmed cases, and the blue are the ones that are waiting for the test to come back. And you'll see, this goes back to the beginning of September on this chart, and you'll see that it looks off to the right, like in those general beds, that the number is starting to trend up a little bit. So this would make sense, remembering that hospitalization is a lagging indicator behind what we would see in the community in terms of our positivity rate and the wastewater. So these are things we need to pay close attention to. But really, to reinforce and to echo what the mayor's saying is that this is our opportunity. We now have indicators that the virus is starting to behave more actively, and that is because our behavior has changed. The virus hasn't changed. The virus is the same as it's always been. It will take advantage of whatever opportunity we give it. We must be giving it opportunity because it's starting to spread. And so this is our window of opportunity to slow down the virus so that we can keep people from being hospitalized and keeping people who get hospitalized from going to the intensive care unit. And this is all very important. It's very doable. We've done it before. We know how to do it. I don't have to tell you again, but it's wearing a mask, washing your hands, don't gather in large groups. And with the holidays coming, we're going to talk about that in a moment. With the holidays coming, it's going to become all the more important that people are diligent in paying close attention to what they do and that we support each other. So those folks who are being really diligent, we should respect and support their behaviors as they do this. Nobody should be feeling embarrassed or afraid to wear a mask or afraid to socially distance themselves. That's the smart thing to do. And remember, again, the mask that you wear, it protects you a little bit, but it mostly protects the people around you in the event that you're one of the 40% of people who are infected that don't have any symptoms. Again, about 40% of the people who are infected have no symptoms, so they have no idea they're spreading. If they knew they were spreading it, they would have stayed at home or they would have kept away from it. So this is why we're wearing the mask. So the biggest thing about wearing the mask is it protects those around you. It also gives you some protection from catching the virus, but it's showing respect and concern for the person next to you. Thank you, Mayor.
Thanks, Dr. Pearce. I want to also remind people to get your flu shot. So please take advantage to get your flu shot. And then just bear in mind, we've got a number of kids that are in school in person, teachers, janitors, cafeteria workers, bus drivers. And so by wearing the mask within our community, it helps them and keeps them safe. And then as we get ready to move into November and December, really the heart of the holiday season, keeping these masks on not only protects your health, but it also protects in part our own economy. And so please bear that in mind. I know while I was riding around on my bicycle over the weekend, I noticed people gathering at people's homes or on their street blocks, and many of those individuals did not have their masks on. So please, let me reemphasize the importance of keeping your mask on. Before we open to questions, I want to note that Halloween is approaching this weekend, and I want to discourage people from gathering in large groups. The city we're not canceling Halloween, but we are encouraging people to forego traditional trick-or-treating and Halloween gatherings this year in favor of safer alternatives. Going door to door and attending traditional Halloween events are high-risk activities for spreading COVID-19 during the pandemic. A safer alternative is one-way trick-or-treating, where individually wrapped goodie bags are lined up for families to grab and go while maintaining a safe social distance. So, Ada, if you'll just, yeah. This is one of those bags that's wrapped with goodies. Not the sort of candy I like, but for purposes of demonstration, candy is on the inside, and you just place them out on a table in front of your home, for example, and the kids can come along and grab a bag and keep going. This can be accomplished by setting up a table or a blanket at the end of your driveway or at the edge of your yard. Haunted houses and that's instead of, Ada, if you give me that orange one. This is what I normally would have at my house when kids come, would be like a big bag like this, and then I would just put it out in front, and the little kids were very nice. They would go in and grab like one or two. The big kids would grab a whole handful, and sometimes on one occasion, one of the big kids just grabbed the whole bag out by hand. I remember him. But this version, this version is a no. Put an X on this one, okay? This is not the safe way, where you are having them come to your door and they're reaching in and they're taking the candy. You don't want to do this. You want the other version where you're setting up a table. Now, the haunted houses and other indoor activities are also high risk. Haunted houses are high risk for COVID-19 transmission. Bear in mind, in the haunted houses, not only will you find the ghosts, but you will find COVID-19. So you want to stay away from the haunted houses, especially in large groups. So there are safer options. What I would recommend, instead of going to the haunted house, just get you some candy, sit on a sofa, and watch reruns of the municipal channel. Starring Mayor Pro Tem Dave Martin and the 16 other council members, the reruns of the municipal channel while you eat your candy. So that's what I would, that's like a haunted house. I'm sorry, let's be serious. Remember, a costume mask is not a substitute for a face cloth mask. A costume mask should not be used unless it is made of 2 or more layers of breathable fabric that covers the mouth and nose and doesn't leave gaps around the face. The bottom line is we're still in the midst of this storm pertaining to COVID-19. Please keep your masks on, engage in social distancing, proper hygiene, and let's do everything that we can not to have a resurge of this virus that we experienced in June, July, and August, and that others are experiencing in other cities throughout our country and in West Texas. Our behavior can pretty much dictate our destiny. So please govern yourselves accordingly. Having said that, we'll stop and take any questions anyone may have.
Yeah, use the microphone, please. And we'd like to deal with questions related to this news conference first. Okay, thanks. Yes, please.
Good afternoon, Mayor.
Good afternoon.
This question is from KHOU. This summer, Houston hospitals ran short on remdesivir. Some had to restrict the medicine to only patients who were not on ventilators, yet to try and make the supply last longer. Could we see those same restrictions in place this time around, or does Houston have more vials ready to go?
So, as you know, remdesivir was just recently approved by the FDA for widespread use, and so the manufacturer has been anticipating that and creating stockpiles across the nation. So I don't anticipate, but quite honestly, what we need to keep in mind is it's a supply and demand. So there is supply. What we need to do is reduce the demand, right? So if we have a huge outbreak, I don't know exactly how much remdesivir is in the Houston market. Remember, it's being heavily sought after across the globe, not just across the nation, but across the globe. And so we don't want to wind up in that competition. So, wear a mask, social distance yourself. Right now, I think from my colleagues in the hospital, I have not heard them talk about shortages, but let's stay ahead of that curve.
All right. Thank you, Dr. Peirce. This is also from KHOU. Are patients from Texas COVID-19 hotspots like El Paso being brought to Houston?
That's a good question. So we've had communication. I'm going to be talking from the SETRAC standpoint. And we have had communication. We've been coordinating with the Department of State Health Services as well as TDEM, Texas Department of Emergency Management, on moving patients from not only El Paso, but also potentially Lubbock, Amarillo, and the Valley to Dallas, Austin, San Antonio, and Houston, and trying to spread that. I am not aware. On Saturday, I was told that we could look to be getting between 2 and 4 patients a day. I'm not aware just yet as that whether we've actually received any patients. But a couple of things is the plan is in place, the connections have been made. At this point, it looks like the volume of patients to be moved will be very, very small, and let's hope it stays that way. But this is Texans helping Texans, and this is what we do, and we're prepared for it. But hopefully, it won't spiral up any bigger. And then really, hopefully, we don't have to do the reverse at some point, where we have to start moving patients out of here. But the plan is in place.
And actually, another follow-up on that. I did see that El Paso actually put out some of the locations where they believe or the manners in which the virus had spread. So, for example, they had identified restaurants and going to big box stores. And is there anything like that in the city of Houston where we've sort of been able to identify where this virus is spreading and how?
So it's a difficult question to answer because you have to take the information we get with a little bit of a grain of salt. So when we ask the folks that are known cases, where have you been, right? And we ask them where they've been. Well, nearly everybody's been to a grocery store. That doesn't necessarily mean that grocery stores are places where it's spreading, right? So you have to, what we are finding, what we find cases within families and such, is there does tend to have been a large family gathering or some sort of other social gathering that may have been, well, I don't want to call it a super spreader event, but that would probably be the closest term to it. It's hard to know for sure because we still have reluctance on people to give us all the information, which we understand. But right now it appears that from what we're getting is that it is those probably family gatherings or special events that people are going to and not wearing their masks and not social distancing.
Okay, thank you. Sorry. And let's see. Oh, this question's from KRIV. And this is for, I believe this is for the mayor. Yeah, question for Mayor Turner. Can you go over the areas of town that you are the most concerned about the rise in crime, and also when will the initiatives begin?
I think there are 8 or 9 areas that have been identified by HPD. And it's from the north end to the southwest end of Houston, southwest, midwest, where we've identified where the high crime rates. And that's where we're going to be focusing the extra of the overtime initiative between now and the end of the year. So the plan is to place the equivalent of 107 police officers more on the street every day to combat these crime initiatives. In addition to that, as you know, we've expanded our human trafficking, domestic violence initiative. So we've done that. We've created the mental health hotline for people to utilize 1 p.m. to 11 p.m. every day. I want to say 713-999-9442 for people who are experiencing mental behavioral health issues, needing counseling services. So there are a number of other things that we've done. But the overtime initiative as it relates to HPD will be focused on about 8 to 9 different key zones throughout the city of Houston.
And they also had a follow-up. They said there are some concerns that increased patrols in areas like the Third Ward could lead to racial profiling. What are your thoughts on that?
Well, number one, that there's a policy against racial profiling. These efforts are intended to address where we see a proliferation of crime. Quite frankly, the people in these communities have been asking for more patrols, more of a police presence, whether you're dealing with in Third Ward, whether you're dealing in the Southwest area of town, Midwest, along North Belt, in Southwest Houston, for example. These are communities and neighborhoods and areas who have been asking for more. People have been complaining that the response time has been too long, okay? And so bear in mind, we have 5,300 police officers attempting to cover 670 square miles, so that's a lot of geographical area. So the goal is to reduce the crime activity that is taking place within our city. You've seen where, for the first time, I think since I've been here, that where we've gone over 301 homicides. And so the program is intended to do that, but not just the overtime alone. There are the other initiatives that we're put in place. So it's no one's intent to engage in racial profiling. The only profiling that we're attempting to engage in is to identify those people who are violating and committing the crimes and to get them off the street.
6 areas.
It's 6 areas? 6 areas. I said 8 or 9 is 6. Thanks.
Oh, okay. And this is from KPRC, and it's a question for Dr. Peirce. And it is, according to the Texas Medical Center metrics, the daily average number of people testing positive has gone up in each of the previous 5 weeks. However, hospitalizations have remained relatively flat. What are your thoughts on that? Could it be that more people are testing positive but not requiring hospitalization?
Yeah, good question. That's exactly what it appears, is that we do have the virus spreading. We've noticed, and we've mentioned this before, that it appears that the virus is spreading through a younger population, which tend to require hospitalization less. So that's some degree of good news, but we then worry, are those younger folks going to go and spread it to grandma or to an older aunt or uncles, right? And so that's why we're going to keep a close eye on the hospitalization numbers, because there would be a greater lag between when the numbers of tests went up and when people wind up in the hospital if you have to go through 2 generations or 3 generations of infection before people wind up in the hospital. So for the young folks out there today, I would say recognize that you are at an even greater risk of being infected and not knowing it. So if you've been to a party or you've been to, certainly if you've been involved in activity where you think you may have been an opportunity for exposure, or if you even have the mildest of symptoms, you might want to, get yourself tested. And you might want to really make sure you stay away from your grandparents a little bit until you know that you're not infected, because this is exactly the advantage that the virus will leverage to spread to those who we are most concerned about, if that makes sense.
There's 2 more questions. One is COVID-related, one is not. The COVID-related question is, several Texas cities are seeing spikes in COVID. Pandemic experts say that cities over the winter months could be hit even harder, and particularly in El Paso. There's actually a curfew right now. Is that a possibility for Houston?
Well, right now we're trying to stay ahead, and that's why we're encouraging people to recognize what's taking place in other parts of the country, as well as in West Texas, and seeing how the virus is heading in this direction. And so instead of waiting until, let's say it is actually here and we are in the midst of another surge, let's be mindful of the behavior that we need to practice in order to prevent another surge from taking place in the city of Houston, like what took place in June and July. And if we do that, then we don't have to worry about other measures that would have to be more drastic. What we do know for right now, the vaccine that works happens to be these masks. These masks represent the vaccine, and this mask does work. And so if people will simply wear their mask, if 90% of the people are wearing their masks every time they're in the midst of somebody else, especially in public, and when they are around other people, they keep their masks on, then that will help to dramatically slow down the virus and will lower the positivity rate within our community. If we do that now, and that's why we're waving the flag right now, if we do that now, then I think we can avoid another major surge coming into the city of Houston.
Thank you, Mayor. And the last question is not COVID related. Would you like me to ask that now? Or?
Sure.
Okay. This is also from KPRC. And it's asking for your response to the group seeking a change to Houston's charter to make the city less of a strong mayor form of government. They claim items don't make it to the agenda without the mayor's approval, so they're wondering what your response is to those claims and efforts to reduce power.
Well, this is nothing new. I mean, the city is 184 years old, and as far as I can recall, it has always been a strong mayor form of government. The structure has not changed in quite some time, and I think it works well, you know, for the city of Houston. I think what is being proposed would create chaos and confusion, and we simply don't want to have the D.C. model. And when I mean that, what's happening in federal government in D.C., that style of contentiousness right here in the city of Houston. I think the model that we have in place works well. People do have the opportunity to have their say. You know, I can't think of hardly any issues where people have not had an opportunity to have their say. But look, I'm the mayor, and that's so people maybe see it through my eyes. Let me yield to the mayor pro tem. He's a
Yeah, and I don't know anything about the press conference, but we tried this during the Parker administration, and it didn't work out so well. But what I do know in the Mayor Turner administration is that if ever I had a passion for an agenda item and went to him with that passion, it was on the agenda. So its ability to communicate and to have dialogue and to understand each other, but in a strong mayoral form of government, a lot of things reside within the mayor. And unless people want to change the city charter, I will keep doing what I'm doing, and that is I meet a couple of times a week with Mayor Turner. If I have an agenda item or if I need some help with something, we have a dialogue, and 99.9% of the time I have the ability to have that dialogue come out in council action. So I think it works well, but it works well with communication.
And lastly, what I would say, if the goal is to create chaos and confusion, that will do it. If that's the goal, to create chaos and confusion, that'll get there. But if the goal is continue to be very result-oriented, to run with, based on a collaborative approach, even though it's a strong mayor concept form of government and governance in the city of Houston, but to do it in such a way where it's not always cantankerous or contentious, then this is the best way to proceed.
Thank you, Mayor. Dr. First.
Thank you.
Mayor, I was going to ask you about that same event.
Sure.
I think there was some confusion this morning about what exactly they were calling for. I was at the press conference. So they're not calling for a change to the system of government. They're not calling for a weak mayor government or something like that. What they're calling for is the ability of 3 council members to be able to sign a request to get an item on the agenda, the weekly agenda. So just curious, you know, if your response remains the same to that.
100%, no deviation from my previous response. Because what it ends up doing is that it takes you away from the critical things that are important to the people in the city of Houston. If you are constantly, there are a total of 17 of us on city council, and if, for example, any 3 can continuously bring up additional things, then you'll be spending all of your time dealing with those items. And it takes away from everything. It takes away from everything else, and it creates a very contentious and confusing and chaotic session. Who wants that? Okay, if they want that, they can go to D.C. Okay, but not here in the city of Houston. I think the model that we have in place is one that has worked for us for a long, long, long time. And I don't know how long it's been here. I know I'm relatively young. And it's been, the model that we're operating has been here since, well, how long? Macy days, even quite some time. So I'm a little bit at a loss to understand why people would bring it up at this point in time. Okay? But it creates chaos, confusion. It's not in the best interest of the people in the city of Houston. But I respect their right to advance their ideas. It's just not an idea that I think works best for the city of Houston.
Thank you.
Certainly.
I was going to ask a follow-up question since we are talking about management of local government. I think most of the time the question is when people feel that the mayor at the local government level is the chief policy maker, is also the executive officer, and there is this seemingly over-concentration of power in the hands and office of one person. They have compared that to the operations in San Antonio, where we have a strong managerial system that is run by a manager of the city, and the mayor sits as the chair of the council and moves these council decisions to the managerial executive. That doesn't operate here, but I think that since you said we've not had the same problem, there's no problem. But I've actually worked in Washington, D.C. for almost 5 years, and I've been working with Muriel Bowser for some time. And I think that a lot of the confusion with D.C. is the fact that they look at the federal territory under the control to an extent of Congress. So the mayor is always fighting and struggling to work with the Congress to be able to carry out certain decisions. And they are not similar to what is operating in Houston or San Antonio or in Dallas. So I want you to speak to the difference between what operates in Houston and Dallas and San Antonio, and why that could be really the reasons why people keep bringing all of these things up of, we think there's too much power in the hands of one man, let's redistribute it. Thank you.
I don't operate with a great deal of power, you know. Look, and when I was referring to D.C., I wasn't referring to Mayor Bowser. I was referring to Congress and the House, the Senate, the President, and all of that being very contentious. I think the reality is, look, people don't want chaos and they don't want confusion. And we have these elections now every 4 years. If people are not agreeing with something that the mayor does, they can vote that person out, whoever is the mayor. Same thing with members of city council. You know, they certainly have that right to do that. In most cases, most of the measures that have come before us since I've been mayor, there's been very strong support on any particular measure. Very seldom have there been measures that have come before us where the vote has been, let's say, 1 or 2 or 3 vote difference. In most cases, the margins are much, much bigger than that, which means that we work very hard to do where we can to establish a consensus. But when you look at analyze most of the votes that have taken place before city council, the overwhelming number of those votes have been 13, 14, 15, 16 are unanimous. Just like the budget that we just approved in June. That was unanimous. That is the one thing that we must do every single year. And that budget was unanimous. You don't get that without establishing strong consensus. And we operate on a bipartisan basis. Very seldom, I can think of just offhand, maybe 3 times when the vote has been within 1 or 2 or 3 vote margin. But in most cases, here in the city of Houston, when we have voted, the margins have been fairly large margins, if not unanimous. And you don't do that without taking people's views into consideration. And I do my very best to take people's views into consideration. But what I will say to you is something that my dad used to say to us all the time, and that is anybody with more than one head is simply not normal. Okay? Let that sink in for a while.
No, it sank, but the point I raised was, I wanted you to reflect on how useful could the system of governance at local level in San Antonio and Dallas be to Houston if we tried it? Because there we have a manager of the city.
Yes.
And a mayor who is more like the the chair of the city council.
Well, you're getting two for the price of one in the city of Houston. You got the chair and the manager all in one,
Okay.
and you pay me accordingly. You know, take a look at what the city managers are making in those other cities, okay? You take a look at what the city managers are making in those other cities. In this city, you got your city manager and your mayor all in one. And on top of that, with all due respect, with exercising some degree of humility, all of those cities are following Houston's lead. Okay? Why change something that's working? Okay, that's my attitude on that. So, but I appreciate the opportunity to answer that. I hope that answered the question. Okay, thank you all so very much. Appreciate it. Mask up, everyone, and come and get your. Well, no, you can't get this candy.
That's my candy. That's my candy, don't eat it.